So let me show you a quick tip on how to stabilize your spinal column so that you can perform higher level activities. Most research discusses the impact of poor spinal stability, poor lumbo-pelvic stability, and the occurrence of back pain or any pain really in the body. Any corrective approach should be focused centrally on spinal control. Now, spinal control isn't just core abdominal muscles, but getting the sense of how to establish core stability comes from what's called the transverse abdominal muscle and our multifidi. It's very hard to palpate or feel our multifidi muscles, which are small little muscles inside the spinal column. But our transverse abdominal, if you feel along the edge of your stomach and you press into that hollow area and then you tighten, you'll feel, I'm not necessarily tightening my abs like a crunch. I'm pressing my finger into my stomach and then pushing out on it. That's your transverse abdominal. That muscle's only responsibility is to stabilize the spine with contributions from the multifidi in the back. But once that transverse abdominal engages, it's kind of like a weight belt around you. It's got stability. Now we have to learn how to use that stability in movement. So the best example is just press yourself, find that little hollow area of your stomach and push your finger in. And then tense your stomach up, pushing out onto that finger, not sticking your belly out, not changing the position my pelvis is in, just pressing into that finger of your stomach, and then starting to even walk, feeling that muscle engagement, the abdominal engagement, the transverse abdominal engagement as you move should be constant, and it's not necessarily a muscle that's responsible for a lot of movement. It's responsible for stabilizing. So the more we can do that and teach the abdominal, transverse abdominal, how to stabilize us when we move, the more spinal stability we have and less pain. So give that a try and let me know what you think.